Good afternoon, everyone. Thanks for joining us on our media briefing for this Wednesday. We have a full agenda today, so we're going to go ahead and get started. We're going to start with some information about fire recovery and winter preparedness with Kelsey Scanlon, an emergency planner with Office of Emergency Services. Hi, Kelsey. Boy, the rainy weather really brought winter preparedness into focus, didn't it?
It did, and we got very lucky with how little rain we got over the period of time that it did rain. So tonight at 5:30 p.m., our office, in conjunction with Supervisor Adams's office, the National Resource Conservation Services, and the National Weather Service will be hosting a post-fire winter storm preparedness webinar. And it will include everything from talking about the 2021 winter storm outlook, how burn scars are more subject to flash flooding than normal winter seasons, and generally the science behind any type of land movement, from mud flows to debris flows to landslides to flash flooding. Then we'll talk about how property owners can mitigate their property so that excessive erosion and runoff does not occur, or that or how to protect their property from experiencing a debris flow or flash flooding. And then we will talk about how property owners or anybody in the community within 1 to 2 miles of the burn scar can prepare themselves in the event of a debris flow or flash flooding. So that will include planned evacuation zones, emergency messaging, general principles for flash flood advisories and what it means to the actual people who receive the message. And then we'll talk about response. So what to do once the rain starts, sandbagging, stuff like that. And then we'll talk about recovery. So making sure that property owners have everything that they need to recover quickly with available resources, primarily financially through insurance. And then we'll leave time for a Q&A and talk about the next webinar, which will be on December 3rd, specifically about debris removal.
I just want to let everyone know that Kelsey is going to jump off the call after she's done. So if there's any questions about the webinar or maybe an update on how recovery efforts are going up in the burn scar area, this would be a good time to ask her any questions that you might have. And let me see if there's anything. Question for you, Kelsey, for the December 3rd webinar, same time?
Yes, that's correct. So December 3rd is 2 days after Cal Recycle should have begun debris removal for homes that were destroyed from all 3 fires. So if there's questions or people haven't submitted ROEs or opt-out waivers, they can ask more questions then before the deadline approaches. But short of the long, yes, it will be at 5:30 on December 3rd.
Do you also want to say a little bit about ROEs? Because I know that that's an important subject for folks in the burn areas.
Yeah, of course. I'll also answer this question really quick from Adriana Frederick. You can find the webinar information on the recovery webpage, as you can with all things recovery related, and the URL is right there at the top of the page, or you can look through the county news section. May, what was the question? One more time.
ROEs.
Oh,
right of entry.
Permits are so property owners who have a destroyed home and wish to rebuild need to submit either an opt-out waiver or a right of entry permit by December 15th. There's no third option. You have to submit one or the other, otherwise the county will move forward with abatement at the cost of the property owner who chose not to submit documentation or paperwork for either removing the debris on their own or going with the government consolidated debris removal program, which is free.
All right. Thank you for that. And if there's any other questions for Kelsey before she steps off and we move into COVID information, this would be a good time to ask. And I'm not seeing anything. If something comes in, I'll forward it to you. Thank you very much, Kelsey, for dropping in on the media call today.
Thanks, Maya.
All right, now we're going to move on to our COVID-19 topics, and we're going to start with assistance, and we're going to talk to Lee Takakawa, who's with Cal Coastal, and he's going to tell us some more about affordable loans for businesses and some additional funding that's now available. Hi, Lee.
Hi, Mia. Thanks for having me. I am here to announce some additional resources available to small businesses. As you know, this pandemic is a very serious situation, and we're seeing businesses struggling all through this. So with additional stimulus measures a ways away, I don't see anything happening anytime soon for the economy and additional stimulus. This really could be a lifeline to many of the small businesses that are struggling in our communities. All of you have seen probably what I've seen. It's very heartbreaking, and we want to do everything we can at Cal Coastal to deliver the resources to these small businesses. So I'm asking for the help of the media to deliver this message if possible. Our Small Business Development Center, we've been busy providing assistance. We've helped over 22,000 businesses during the pandemic with PPP loan applications and forgiveness, with SBA economic injury loans, and doing many of the loans ourselves. We have also been assisting people with our Monterey County Revolving Loan Fund, and we've done over 20 loans, that resulted in the county getting additional money, 1.6 million under the CARES Act from the Economic Development Administration. So we're revitalized with new capital. We want to deliver it. It's completely available to businesses. I have come to the media call before, and at that time we were only doing $25,000 microloans. But now we're able to actually go up to $400,000 with some of the loans on a limited basis. If they're 25,000 or less, we can still do emergency microloans at a very quick turnaround time. We've been able to fund many of those loans within 5 to 10 days of getting an application. With the larger loans up to 400,000, that'll take additional time for our approval turnaround time. But I just wanted to announce that because these loans are super affordable. We've been lending them at as low as 2.44% fixed rate. Of course, businesses would prefer to get grants, but this is our next best option. It's a loan where we're trying to be affordable, quick, and structure them with their ability to pay. So many of these loans are giving them up to 9 months of no payment. Interest still accrues at the 2.44% during that time, but they don't have to make a payment during the initial months of receiving a loan. So this could be a game changer. It's only for working capital for the Monterey County Revolving Loan Fund, and they must be within the Monterey County area. We can't go outside of that. It's very specific to the government funding we got. Secondly, I'm here to announce another program funding resources that we got through the Community Foundation for Monterey County. They've been a huge partner to many nonprofits during COVID. And actually, you've seen some of their programs where they provided us some support grants to serve the public and the communities with our COVID-19 activities. So Community Foundation has provided $350,000 to Cal Coastal through a grant where we're able to make small business loans to businesses within the city of Salinas. These funds come through the James Irvine Foundation, and they're channeled through the Community Foundation for Monterey County to Cal Coastal. There was one other nonprofit in our community that also received an award. We got 40% of the funding. The El Pajaro CDC in the Watsonville area also received 60% of the funding. And as you know, they manage a fund called Grow Salinas. So both of us as nonprofits are trying to deliver these resources. With this 350,000, we're looking at microloans, 10 to 25,000 dollars. They're from 3 to 5% interest rate. We determine that based on their need and ability to repay. We can do startup businesses, which we can't do under the Monterey County Revolving Loan Fund. And they can be for different uses as well, not just for working capital, but they can also be for machinery and equipment or furniture, fixtures, and those types of things. So it's a little bit more flexible. We are targeting Latino-owned businesses because what we found during the pandemic and trying to deliver these emergency loans is that many of the Latino businesses don't even know how to use a computer. So here we are trying to all deliver virtual resources to the small businesses, but many of them don't even have a computer. They don't even know how to turn a computer on. So that's what we're trying to do, is we're looking at helping Latino businesses. I think the pandemic is changing the way business is being conducted, and these businesses need to sell some of their product online or have a website or even an email. It's almost mandatory given the situation we're in. So these are some of the two programs that I'd like to announce. We are going to the media right now. Maya had, thank you, Maya, for sending out a press release. Last Friday, we were carried by KSBW, but I do see someone from KSBW on the line. Unfortunately, our contact information is Cal Coastal, and our phone number was not provided. So anything you can do to make sure that these businesses know who to contact. We are the administrator for these programs, so they do need to contact Cal Coastal to be able to get these loans. We're going, the best way to do this is at our website, www.calcoastal.org, www.calcoastal.org, and they can fill out a pre-qualification. Our phone numbers for Cal Coastal would be 831-676-2020. And for our Small Business Development Center, it would be 831-676-2017. And we provide free technical assistance. So what I wanted to do is reach out to the media to deliver this message to the small businesses. This is getting very serious, and we want to do everything we can to send this message out. I paid for media advertising. We're going to be in Monterey Weekly, Monterey Herald. We're going through both Monterey and Salinas chambers of commerce. So we want to deliver this message, and we want to do it in a timely manner. So many of the holidays are coming up, and it's a horrible time to promote this, but time can't wait. Every day counts. Thank you for having me. I do hear some background noise, Maya. So hopefully you can hear what I'm trying to deliver. Thank you.
Yes, thank you very much for that important information. And then for people who are not speaking, if you could go ahead and mute your devices that you're on, that would help everyone else hear the speaker. And thanks, Lee, very much for the really thorough rundown of the information that you provided. And if there's some, I can do a follow-up send out to the press if anyone needs websites or phone numbers, I can certainly do that. All right, and then if you would stay on the line for questions, that would be great.
Thank you.
Next, we're going to move on to an update on an outreach program that the county has launched in some of the harder hit areas in our community, harder hit by COVID-19. And we're going to talk with Krista Honey from the Health Department and Rosemary Soto from our County Administrative Office about this outreach effort. Hi, ladies.
Hi, good morning or good afternoon. This is Rosemary Soto.
And this is Krista Honey. Yeah, go ahead, Rosemary.
Yeah, thank you. So we're going to tag team and share an update on our efforts to develop this community engagement component of our response and recovery efforts overall. We have partnered with community-based organizations that have already done some great work around the dissemination of information for prevention and resource connections to services that are available to those who are most impacted by the pandemic. And what we, some of the partners that we have begun to work with include, for example, Building Healthy Communities and Líderes Campesinas, among others, right? And we are continuing to grow this list of partners and that are completely engaged in and committed to assisting us with the development of this component, making sure that our strategies are culturally responsive and linguistically appropriate, so that way our messages are well received and understood, and that are the resources and the program supports that are available are really meeting the needs of the community who is most impacted at this point. What are components in terms of the strategies that are included here are assisting with appointment access to testing. We understand that currently most of the testing that is provided is requiring an appointment, which is done online. And we understand that there are barriers to access because of that method. And so we want to make sure that we are increasing accessibility to testing sites. And so there includes a strategy where our outreach partners will be able to assist the public with securing an appointment for testing, as well as at the testing sites. We want to make sure that those who are coming through our doors to take their testing have enough and important information for where to go for any resources and services that they might need, if they are in fact returning with a positive case, or in case if they have any other indirect impact that they're experiencing and they need that support. So there is that outreach and education component that is done as well, that is more reaching to the more general public in those specific census tracts that have the highest index in terms of its impact. And I will turn it over to Krista in case if I missed any points, if there is anything that is important that should be known.
Just to reiterate that this is really about enhancing all the really good work that's already been underway that our CBOs have been taking on. Many of them have been reaching out to the communities that are impacted already. We're hoping with a curriculum that has been developed and used extensively in Fresno, and one of our partners has been using, to continue to support with them the information to get out to the community, work on really sort of the mutually reinforcing activities across the CBOs, helping with coordination across that, and then supports to continue what we'd already done with Rosemary's guidance and the guidance of a couple of the other CBOs with that coordination for census outreach, where it's the same idea where like you're going here and we're going here, and that's a means of ensuring that they're coordinating where they're going, when they're going out into the community, how they're going out into the community, because they all know each their own communities well as to, would phone work better? Would it be better to be at a food distribution site, et cetera? So just to really expand and enhance across what's been happening and coordinate that together.
All right, thank you both very much. It's really great to have an update on this program, which really takes on new significance as we see numbers change and things change in California with COVID. And if you both would stay on the line in case we have any questions after the rest of our presenters. Now we've got Dr. Moreno on the line. He's going to give us an update on COVID-19 metrics and measures, I think. Hi, Dr. Moreno.
Hi, Mia. Good afternoon. How you doing?
Good, and you?
All right, thanks. Yes, so Mia, yeah, I just have a few updates. Hopefully, I don't know they'll take too long. I'll start by just pointing out that the governor has announced that there's a significant increase in cases throughout the state of California. And from the governor's analysis, it seems to be one of the fastest increases we've seen in this pandemic. So it has raised a lot of concerns at the state level and also at the local jurisdiction level. And so the state has made some modifications to the blueprint based on the increases in cases. They have moved now some of the counties into more restrictive tiers as of this week. And as of Monday, there's 41 counties in the purple, where previously I think there were 9, Maya, and 11 in the red, 4 in orange, and 2 in yellow. And since there were no counties that were moving into less restrictive tiers, the state has this week did not report on the equity index, but did report on the county's positivity rate and case rate. And the state did notify local jurisdictions that they will be looking at this again. So they've been looking at this and issuing tier assignments on a weekly basis, usually announcing it on Tuesdays, but because the rate of increase is so steep, they're going to be looking at this probably more than once a week, and they may make some decisions when they feel that they have to take further action. For Monterey County, we have at least it looks like for at least 3 weeks now, had evidence of increasing numbers of cases here in Monterey County. And we also have had an increase in hospitalizations due to COVID-19. So for the months of September and October, we were looking at about around 30 people in Monterey County hospitalized for COVID-19 in our 4 hospitals. And that number as of a couple days ago is closer to 50, is around 50. And so that has been increasing over the last couple of weeks. And that's another indication of increased transmission and the impact of COVID-19 on our community. The ICU bed availability remains stable right now, but we'll have to wait and see what happens as when people get hospitalized with COVID-19, some of them eventually do okay and not okay, they survive and they get discharged. Others don't fare so well and they can deteriorate after about a week or 2. And those are often the ones that wind up in the ICU. So we've had 1 or 2 weeks of increase in hospitalization beds. We'll have to wait and see what happens to our ICU bed census and availability of ICU bed and ICU staff to take care of Monterey County residents and visitors. So this is a serious situation, and the state has acted accordingly. The state is, as I mentioned, may do reassessments of case rates and positivity rates, and may make tier assignments on days other than Tuesday. So that's one change in this blueprint process. And the state did and can move counties back more than one tier, more than one restrictive tier, if the state believes that it's necessary to do that to immediately take steps to reduce transmission of COVID-19. And the state was waiting for allowing a county to have 2 weeks of metrics before moving a county into a more restrictive or less restrictive tier, but the state is not necessarily waiting those 2 weeks. And what they did this week was there were some counties that could have been afforded 1 more week to see if their metrics would improve or stabilize. But at the rate that COVID is increasing in Monterey County, in the state of California, it's highly unlikely that a county with an increasing, worsening metrics would stabilize their metrics from 1 week to the next, seeing what's going on statewide. So like the state did move some counties with just that 1 week of rising metrics into more restrictive tiers. And then finally, the state has been reviewing adjudication requests from counties, but some have been approved, some have not been approved. But at this time, the state has notified us that they are not going to, tier adjudication requests are very unlikely to be approved at this point because of the worsening situation in California. So for Monterey County, we have an adjusted case rate of 14.1 as of Monday, with a test positivity rate of 6.1 and a HPI quartile positivity of 7.3. So all those are increased. The case rate is increasing, and the positivity rates are slightly increasing. They're both in the more or less stabilized, but our case rate is definitely going up, which means that we have more cases per capita at this time. So it really comes, it comes back to, at this point, continue to take steps to slow down the spread of the virus. Again, it's going to be that's really what we need to do until we can get the people to be vaccinated against COVID-19, which is quite an effective way of controlling a pandemic due to a virus like this SARS virus that causes COVID-19. So until then, we need to continue to limit our gatherings, delay or postpone travel, use face coverings, keep our distance from people who aren't in our household. And we'll continue to expand testing availability so that people can know what their status is with COVID-19 and connect that with isolation and quarantine for those who are infectious or are exposed and could become infectious. We'll continue to create some pop-up testing sites throughout the county, and we're going to hopefully soon add a few more OptumServe testing locations for Monterey County residents. We're also participating in distribution of antigen test kits to local providers. These are the tests that can be done within, I think it's 15 to, once the test starts, the results come out within 15 to 30 minutes, and it can guide healthcare providers who are presented with a person with symptoms of COVID-19 to determine whether they have COVID-19 or unlikely to have COVID-19. So our public health laboratory director is offering and providing training to local providers on how to appropriately use these antigen tests to make sure that they're used appropriately and we minimize the false positives or false negatives that can sometimes arise from using these antigen tests. Krista and Rosemary are also providing another important part of strategy, which is working with enhancing what we've been going on already in the nonprofit community-based organization sector and in filling in some of the gaps and improving access to available supportive resources for people who are concerned that they might have COVID or tested positive or been exposed to COVID. And then finally, I did mention the vaccine. That's, again, once people we have the vaccine and people are getting vaccinated against COVID-19, that's when we're going to really see should be a very effective prevention measure. We've been able to make significant impacts on other infections through vaccination programs. So we're looking forward to this vaccine availability and vaccination program throughout California and in Monterey County. So I can stop there, or if you want, I can talk briefly about 3 recent guidance documents that came out from the state, whatever you prefer, Maya.
Why don't you knock those out?
Okay. All right. So many of you may have heard and read about the guidance documents that came out. There's a updated face covering guidance from the state of California. The state is recognizing, suggesting now that there's evidence that shows that the face coverings can actually provide some protection to people who are wearing the mask. And we've primarily been requiring them so that a person who has COVID-19 who's wearing it is less likely and doesn't know they're sick is less likely to spread the virus in the air by covering their face. But the state is now sharing that announcing that there may be more evidence that it protects the person who's actually wearing the face covering. The guidance again requires people to wear the face coverings whenever they leave their house, and it's not a substitute for physical distancing and hand hygiene, which we need to continue to do. And there are some exceptions for using a face covering. One is if you're in a car with people from your own household, you don't need to wear one. People who are working in an office or room alone don't need to wear one. Persons who are actively eating or drinking, as long as they can keep 6 feet distance from someone else that's not from their household, don't need to wear one. Persons who are outdoors, exercising, relaxing, don't necessarily need to wear one, but they need to have one on hand because as people are out and about and they may cross paths with someone, for example, on a trail. So always need to have one available to cover your face to protect yourself and protect others who are enjoying the outdoors. And people who, in addition, people who are providing, for example, personal services as part of their business to someone, and that service involves working around the face, they can temporarily remove the face covering to receive those services. And there are instances where regulatory agencies like CalOSHA require more protection than a face covering can provide. So that would be another exemption. The state has also pointed out that there are certain individuals who really shouldn't be wearing them. And those are children under the age of 2, which we've talked about before, and individuals that might have a medical condition where the face covering would obstruct their breathing, or a person is not able to properly wear a mask because they are incapacitated or unconscious for some other reason. So those are rare situations, but those would be other situations. So there's a few other exemptions, and I would just suggest people go to the CDPH website, state website, to read up on that. There's the new gatherings guidance from CDPH, California Department of Public Health. The guidance does have several, key areas of the guidance. One is attendance, and the state again recommends no more than 3 households, but try to keep the number of people as small as possible, and try to keep those. If you're going to gather, keep the households the same over time. And again, this guidance is out there because some people insist on a gathering, but doesn't mean that you have to go out and gather, because if you do go out and gather with others, there's still a chance that you're going to get exposed to COVID-19. We're in the purple tier, so the guidance requires all small gatherings, private gatherings, to occur outdoors. And of course, if you're feeling sick, you shouldn't be going to any of these. You shouldn't be gathering with people from other households. People who are at high risk, people over the age of 65, and other chronic medical conditions, are really discouraged from attending any private gatherings. And again, we have to practice distancing and hand hygiene at these events. People still need to wear a face covering. They should keep the gathering short to less than 2 hours or less. And the state does acknowledge that some of these gatherings may be for the purpose of celebrating, or which may include some singing or cheering, and that's strongly discouraged. But if people are going to do that, they should keep more than 6 feet distance from another, and as well as face coverings, because with chanting, singing, shouting, cheering, the virus can spread further than 6 feet. So that recommendation is in there as well. And then finally, there's a non-essential travel advisory. The state recognizes that people who are coming into California, whether those are Californians who have left and are coming back, or people from outside of California coming into California, can be coming into California from parts of the United States or other parts of the world where COVID-19 rates are much higher than we have here. So those individuals are at greater risk of getting exposed, and when they return, they could spread COVID-19 in our communities, in their own households, or in our community. So this travel advisory applies to non-essential travel, and so that would be, for example, travel such as travel for tourism or recreational in nature. So persons arriving in California from other states and countries, it's recommended for non-essential travel purposes, it's recommended to quarantine for 14 days. And if you can, try to minimize your interaction with other people that you live with during those 14 days. Again, that if you come down with COVID-19 because of your travels, you're less likely to spread it in your community if you stay home, and less likely to spread it to your people in your home if you minimize your interaction with them. And also, in general, just if you can, postpone or avoid or postpone travel that's not essential. Try to keep, if you are going to travel, try to keep your travel local. Try to stay within your community, within your county, to minimize exposure. So I'll go ahead and stop there. I can also answer questions about our expansion of testing through OptumServe and the state, if you like. And Karen Smith is here. She or I can update folks on pop-up testing for COVID-19 here in Monterey County.
All right, thank you very much, Dr. Moreno. Thanks for staying on the call for questions. We've got one more presenter, and it's really nice to wrap up the information part of the briefing with some great news. And we're joined by Juan Rodriguez, who's our Monterey County Civil Rights Officer, and he's going to share with us some information that the county was honored for a program that his office developed for civil rights training. Hi, Juan.
Thank you. Hey, Maya. Thank you very much for the platform. I appreciate it. Okay, I'll confess. Part of it is, yeah, I want to tell people that we did receive an award. It's a county-wide effort. It's a training that we developed around 2017, 2018. The Board of Supervisors was ahead of the national conversation on implicit bias, equity, and issues of that nature. We develop a training that is a mandatory training for our employees. It's a 2-hour training that covers implicit bias and a component of governing for racial equity. It has allowed us to provide our employees some tools that will help them understand the needs of the community, right? We have a very diverse community that it's not a cookie cutter answer for everything. So that helps. Recently, you know, I'd like to believe that after every disaster, there's an opportunity. With COVID-19, obviously, we have not been able to do these in-person classroom trainings. We have shifted, however, to Zoom trainings, live trainings that our staff, and I have to recognize also Krista and Rosemary, who are on the call, also help us with our employee training and do a wonderful job. But this shift to Zoom has allowed us to reach out to the community and to other public agencies within Monterey County and to other nonprofits within Monterey County. And we have been able to adapt the training that we provide to employees, that is usually just 2 hours, depending on the needs of the organization. We have been able to do a 3-part series for those organizations that cover implicit bias, cultural competence, and cultural humility, and also an eye towards equity and how those agencies and nonprofits provide services to the community. At the end of the day, you know, even though we're the county, we still live in the county, and all these jurisdictions, I think by reaching out to jurisdictions and nonprofits that service residents of Monterey County, we're doing our part. So I appreciate it, Maya. I just wanted to get the word out. I want to thank the opportunity for I want to thank the board for the opportunity to be able to talk to our employees about these topics. And I just want to put ourselves out there that if nonprofits or local agencies, and why not, I will even open it to other non-local agencies, are interested in our training, depending on availability, of course, and what your needs are, we might be able to meet that need. I don't know if it's appropriate to give our contact information, Maya.
It absolutely is.
All right, so you can reach us. The easiest way is just to go to our the county website and look for our office. It's the Civil Rights Office. Get ready for a pen because we have a really long email address. So it's civilrights@co.monterey.ca.us. If you reach us there, we're happy to start the conversation, and maybe we can work something out in terms of training. So thank you, Maya.
You're welcome. Now, before you jump off, though, you've got to tell people what the feedback rate is for the training.
So I tell people, you know, you really don't want to see me in the county because we're the mandatory training people. But I'll tell you, this training, even though it's mandatory, we have an 84% approval rate from our employees, which I know it's not 100, and I'm always striving for 100, but it's a mandatory training. So it's a really, really good rate. Some of the feedback that we receive, because we do send surveys out to improve the training. And by the way, we've obviously, since 2017, you wouldn't be able to recognize that training, the 2017 training to the 2020 training, because we adapted to whatever is going on in our country and in our community. But part of the feedback that we receive from employees is it's too short, it should be a little bit longer. I wish we could do a little bit more exercises. So it's well received by the county, and I hope, and I do think so, also by the nonprofits and agencies that we provided it to.
All right, thank you. And then if you would stay on the line in case there are any questions. Thanks very
Oh,
much, Juan.
Thanks.
All right, we're going to go ahead and start with the questions that we have. Dr. Moreno, I have a question for you to start off. Has the Monterey County Health Department been informed when the county could start receiving a COVID or the COVID-19 vaccine? When is the earliest county residents could start to be vaccinated?
Hey, man. So we don't have a date where we expect to receive the vaccine at this time, because it really depends on the two manufacturers submitting applications to the FDA for approval to be used in the general population. But until that time comes, we are currently, our health department and California Department of Public Health are collecting information from local agencies to identify specific groups that would be offered the vaccine. And among those groups, we in the state of California will prioritize those groups to determine. And then once we have those priority groups, we can look at the numbers in each of those groups as we go down the list, and allocations to counties will depend in part on how many people in each of those groups we need to vaccinate. So that work is going on right now. I can tell you that we have, most of the people on the phone probably are aware we have 2 vaccines, and that are probably the first 2 that are going to be approved by the FDA to be used in the general population and to the general public. And we have, we're also looking at the transport and storage process for those vaccines. So we have one vaccine that Pfizer that requires colder storage than other vaccines, but there are agencies, including our public health laboratory, that has a freezer that can store that particular vaccine, and also it can be stored for a period of time using containers with dry ice. So we in the hospitals are developing our plans, as long as, just like other counties, on obtaining dry ice and getting our protocols in place in accordance with manufacturers' requirements to be able to store and transport that particular vaccine. The other vaccine that's just been announced also requires cold storage, but it can be stored in temperatures that are the same as the standard vaccine refrigeration storage that a lot of clinics and hospitals have, and also the can be stored for longer periods of time with frozen in the vaccine freezers that a lot of clinics have. So we also, that's fortunate. So we'll have, we're developing protocols for being able to accept, store, transport, and administer vaccine regardless of the storage requirements.
Thank you for that. And then I have another question for you or Karen about the testing sites. Are any testing sites fully booked through an extended period of time? Karen, do you know the status
Not
of?
that I'm aware of. The only 2 that that require appointments are the 2 state-supported sites. The one in Salinas at Cesar Chavez Library, and the other at the one that recently moved to Seaside High School. The pop-ups do not require appointments. They're first come, first served. But I have not seen anything about extendedly being like sold out, for lack of a better term.
All right. And then Dr. Moreno, another question for you. Could you talk about the state assistance to increase testing sites in the county? You touched on it a little bit in your earlier presentation.
Yeah, sure. I'd be happy to. So we have, we made a request to the state. Let me back up. So we have the 2 testing sites that have just been referred to. We have the testing location at Seaside High School, and we have a testing location at in Salinas. And the one in Seaside has significantly increased the number of testing compared to when it was in South County. And so we just got notification from the state today that they're pleased with our utilization of those 2 Optum sites. Their goal is to have at least 85% of the testing capacity utilized on a regular basis of the sites, and we seem to be meeting those expectations at both sites now. So we're very pleased with that. But the state wants to increase its testing capacity from increase it. Currently, it's around 120,000 tests a day in California. They want to add another 150,000 tests a day. And so that depends on local efforts to provide access to testing and the state's effort to provide the lab testing itself, the facility that actually processes the specimens. And so that facility is down in Valencia, down in Southern California. But here locally, we did make a request and we did get approved for one fixed walk-up site, which will be placing at the Castroville Library. And then we have another site that they've approved for South County. They just approved for South County, so we're gonna have a conversation with the OptumServe folks. They're the vendor for California that does the testing, collects the specimens to be specific. So we'll have a conversation with them to agree upon what South County site we will be placing that site, and that's a drive-through location. And it has they can test more people at a drive-through than they can at a walk-up. And these will require appointments, but we anticipate it'll be similar to the other 2 current sites where they can take some walk-ins as well. And then finally, we did get approved for one traveling team, and that traveling team is intended to go to on a rotating schedule where they can go to different schools and provide testing for school staff, and can also go to skilled nursing facilities and assisted living facilities and assist in helping those facilities meet their requirement to have staff tested on a regular basis. And that team hopefully will be able to also respond to outbreaks at congregate living facilities and go to the facility and make it very convenient for staff and, if necessary, residents and others to get tested and take benefit of the, which should be a fairly rapid turnaround time through the state system using the PerkinElmer laboratory down in Valencia. So that's what we have right now. And so I don't have a timeline on when that's going to happen. It really depends on us working with OptumServe and also coming up with working with our other school partners and skilled nursing facility leadership to develop a schedule where we can get the traveling team up and running and visiting a different site every day.
Thank you. And then another question for you. Is there a plan for handling a post-Thanksgiving case surge?
So thank you. So Maya, so one of the concerns that we have in public health and not just in public health and a lot of local organization leaders have is the increase in gatherings that tend to occur around the holidays and on holidays. So we've had this concern with the 4th of July holiday and Memorial Day, Veterans Day, and we're going to Halloween. And so we will continue to do what we can to encourage people to not gather, but during these times. But if they do gather, make sure they at least look at and understand the state guidance for small private gatherings and to continue to take all the measures necessary to prevent exposure. So that's the main thing. Again, this pandemic is the case rates are primarily a result of transmission of the virus and transmission in home settings, household gatherings, small private gatherings, and some in workplaces. So that's where transmission is occurring. And when transmission goes up, that's when our case rates go up. So there is that concern. And so that's basically, as we go from one holiday to the next, the message needs to get out there. People need to think about what what can they do to prevent spread of COVID among their friends and their family, and potentially their coworkers following holidays. So that's basically, we're going to continue to do that. I think Krista and Rosemary, through their enhanced outreach, will work with community organizations to also get that message out. And then if people do feel sick after the holidays, it's very important, again, to they stay home, that they don't go to work, that they stay home, that they're children attending classes, that they don't go to school, and consider getting tested to know if they're positive, and people who are exposed staying in quarantine. So that's basically, we're going to continue to do that.
Thank you. And then I have a kind of a related question. You were talking about holidays. There were 265 COVID cases were reported on November 15th. Did Halloween celebrations and trick-or-treating cause that spike? What does contact tracing indicate?
Right. Thanks. So I did check with our epidemiologists, and they're still reviewing those cases. They're still contacting their cases, and they're still interviewing some of those cases. So we don't have any strong data at this point to link those cases to any Halloween events at this time. But it's a very good question, and we are interested when we see big jumps like that. But one of the results that we may see from that is that some of those cases are actually spread out over time. Again, when we report on a number of cases on a particular day, that's the day in which they come in, and we post them to the system. So as we interview people, their actual date of onset of illness can vary tremendously from the date that it was actually posted. So we have people who were sick, symptomatic for one day, and they've got a test and posted on a Sunday. Or we have people who are sick for a whole week, and then they get tested and they test positive and gets posted on that same day. And we have people who were sick a month ago and they're better, and they just want to know if they're still positive. They get tested and then posted on the same day. So that gets teased out as our disease case investigators look into this. So we'll continue to look into it, and we'll see if there's anything that we can share that might inform the general public.
Thank you, Dr. Moreno. Lee Takakawa, I have a question for you. Is there a deadline to apply for the grants that you told us about?
No, there's no deadline to apply, but they're actually loans and not grants.
I'm sorry, and my bad.
Oh, okay. And that's a very important point. So yes, it's completely available. We do have to deliver the CARES Act funds through the Monterey County Revolving Loan Fund within a 2-year period. And I believe the county received the award a couple of months ago. So the time is ticking, but with this situation, I don't see a problem in delivering the loans within the remaining time. And for the Community Foundation grant, we're trying to deliver that within the city of Salinas, the microloans within a 1-year period. So they should apply now. We'll have 1 more year to deliver those loans. Thank you.
Thank you. And then back to you, Dr. Moreno. I think you talked about gatherings as you answered other questions, but this question kind of really focuses on what advice would you give people who insist on getting together for a Thanksgiving dinner to minimize their risk?
Okay. So thanks, Mia. So my suggestion is that people look at the state guidance, and we're hopeful that people will continue to recognize that we're in the middle of this pandemic. We've got increased cases, and now's the time where we really should be taking extra precautions to prevent transmission of this virus. If people can celebrate virtually, or celebrate, if they can celebrate virtually, then that would be the safest thing to do. So you're not mixing households. People already have have gathered with small number of people. Try to keep that consistent. So for example, if you have two small households that have been supporting each other and meeting to support each other, and you want to celebrate, then you could consider keeping that group together and not swapping out people from your groups or your small private gatherings, because that's really where there's an increase of transmission. And keep the celebration short. Holiday season, especially like Thanksgiving, it's very common for people to spend hours or a whole day or longer with people from other households. Try to keep it short. Be respectful of each other and be upfront with each other and admit that, you know, usually if you're going to gather and you insist on gathering with in a small private gathering, talk about how you're going to keep it short, how you're going to fit in the socializing and the meal into a short period of time. So smaller number, the better, shorter amount of time, the better. Continue to wear face masks. If it's possible, schedule your events during the time of day where it's most likely to have good weather, so you can spend as much time, so you can spend that time outdoors and not have and avoid being indoors. So those are just some recommendations that are consistent with the state guidance that I think people really need to understand. But I really suggest people look at the state website and look at that guidance and understand what the intent is and how those steps can prevent transmission during the holidays coming up.
Thank you. And then I've got a follow-up question that I want to try to get in before the end of the hour. This was a question about whether the county was preparing for a post-Thanksgiving surge. And the question is, are there any efforts to increase capacity to treat more cases after the holiday?
So I think that would, it's a good question. I think that would be a question better suited for people who treat COVID-19. So our county clinics, for example, Maya, or our county hospital leadership might be able to answer that type of question.
All right. And then we've just got a couple minutes left.
We bring our car there, and it's
Christy,
been a while
you
since
need
I
to
had the
mute
brake
yourself.
pads checked, and I got those brake pads like 30,000 miles ago, or 35.
Christy,
They're probably,
Christy,
anyway,
can
just
you mute?
like to get them checked.
Okay. Let me see if I can mute her.
Okay, yeah.
No.
Got it. Okay, I'll try to figure out how to get transportation. It's a Honda CRV.
Christy Markey,
2006.
Christy Markey,
Yeah,
please mute yourself.
yourself. We're trying.
Okay, I'll call before I bring it in just to see how you guys are doing workload wise. All right, and then just one other question. Yeah,
I can't mute her, and nobody's able to get her attention.
Hey, breaks are important, Maya.
They are, and we hope she's going to be safe in her travels. But I hear a break in the sound. I'm going to try to get this one more question in for you, Dr. Moreno. Is the county prepared to implement a potential curfew is the county prepared to implement a potential statewide curfew as Governor Newsom hinted at on Monday? And I think what he may have meant is whether it will follow through and also require a curfew here.
So, okay, man. So I can tell you what I know about discussions about curfew. So what the California Department of Public Health is doing right now is they're reviewing reports from other countries. I know that possibly other states on curfews and what those curfews look like, and to determine whether or not they believe that that's an effective way of reducing transmission. So I'm glad they're talking about it, because they're looking at a variety of strategies, that some of them that haven't been used yet. There are some other counties, I can't recall right now, in California that had implemented a version of a curfew for certain industries, I think. And so they'll be talking to those counties as well.
Yeah, my windshield, I know what happened. I parked it at the airport, and
well, I think do you have anything else you can tell us over Christie's?
Are you able to smooth that out, or
I think we're gonna since we can't undo that. We're gonna wrap up the media briefing and hope that everyone has a safe drive home from wherever they are today. Thanks for joining us on our media briefing. We'll see you next week.
2006 Honda CRV.